I think we've lost actually an individual's response to what they need and what they want. And I think that's massively important when talking about HRT and offering women the ability to make those decisions for themselves, because, that's really what we should be doing, rather than dictating what women should and shouldn't be doing.
Welcome back to my channel, where I post videos every week empowering you to biohack hormone balance in your 30s and 40s. I'm Stephanie Holland, creator of the Body Brain Reset, the ultimate guide to resetting your body and brain and feeling like yourself in your 30s and 40s. Tap that subscribe button to stay up to date on all the latest tips and strategies that me and my guests have for you every single week. Today's guest, Dr. Jacqueline Gatenby, is a UK-based GP, also known as an MD, medical doctor, with a special interest in women's health. She's an accredited menopause specialist and offers gynecology services, as well as having 4 daughters. So she's especially motivated to create the changes in healthcare provision that she wants to see. Let's go. Okay, Jacqueline, so let's dive directly into one of the reasons that a lot of women won't even entertain a discussion about HRT, and that is that it's not safe. So could you explain why body identical hormones are actually quite safe?
Probably what happened that made everyone think that HRT was unsafe was a large study that was done in the early 2000s in America. And unfortunately, that study was prematurely ended because of some analysis of the results, which actually was quite flawed. However, when people have looked back at that study now, they realize actually so many elements of that study were flawed, and certainly the analysis was flawed. And overnight, half of women stopped taking HRT on the basis of that analysis. And really, we are only starting to recover now in terms of realizing that the issues that the study were mentioning at the time in terms of risk of disease were actually very much overplayed. We do know now that the newer types of HRT, which include the body identical hormones, which mean hormones that are chemically identical to the hormones that we naturally produce ourselves, that these hormones are safer than the more old-fashioned synthetic type of hormones that were used mainly in that study over 20 years ago.
Right. And I've also seen across social media a lot of women sort of almost declaring as a badge of honor, they're in their 50s, they're in perfect shape, they feel fantastic, and they've done it all without HRT, kind of giving the impression that HRT is cheating. But frankly, we supplement very many things. We supplement vitamin C, we supplement B12. No one says taking insulin or thyroxine is cheating. So why is HRT not cheating?
The average age of menopause is 51 in the UK, and we know that it is actually quite common. 1 in 100 women actually lose their hormones below the age of 40. Actually, harm can be done if those hormones aren't replaced. So actually, it's not cheating to give you back hormones which actually are going to protect you in later life. The other thing is that there is evidence that women, even at average age of menopause, suffering from symptoms such as hot flashes and sweats, there is an increased risk, even with women who have those sorts of symptoms are at increased risk of cardiovascular disease. So actually losing your hormones at any age, there can be potentially problems later on in life. So having those hormones back, even just for that reason, I would suggest is not cheating and actually is a good thing.
I think what really helped with my mindset shift was learning about the role that our reproductive hormones do play in our body. The role is so far beyond simply reproduction and fertility. It's amazing. I mean, we think about estrogen, progesterone, and testosterone. Collectively, they optimize the function of every single cell, tissue, and organ in our body, including our brain, our skin, bones, joints and muscles, bowel, nerves, heart, bladder, liver, vagina, vulva. I'm not finished. Breasts, psychological well-being, muscles, immune system, metabolism, reproduction, as we mentioned, sexual function, but also eye health and mood and circulation. I mean, that is phenomenal. So when you learn about the role of our reproductive hormones in every single cell, tissue, and organ in our body, then it starts to make sense that when they naturally decline or fluctuate more dramatically than usual and plummet, it seems more logical that you would supplement them in order to feel like maintain feeling amazing, or at least get you back to what you experience as equilibrium within your own body. So talk to us a little bit about why this happens. In a nutshell, what is perimenopause? Why does it happen? And actually, when does it happen?
So perimenopause actually is the time when ovaries start to fail, but they're not failing so badly that periods stop. Usually what happens is there is a real fluctuation of the production of estrogen, and that in a lot of women will actually produce menopausal symptoms even though they are still having periods. And that can start at least kind of 5 to 10 years before your actual periods stop, which is a long period of time, actually, if you're suffering from symptoms and not doing anything about it. Just to go back to your previous point about people saying it's cheating to replace your hormones, I'm sure there are women who, what they would term, breeze through their menopause and don't feel that they have any symptoms, and that's great. However, the majority of women do have symptoms, and we know that 1 in 4 menopausal women will have severe symptoms. So it's not just a few women. This is, I would say, the majority of women would be able to tick one of those symptoms on the symptom checker list, and probably at some point causing a problem with their daily functioning. And as you said, we have cells everywhere in our bodies which depend on estrogen. And when those cells don't receive the estrogen, they tend to malfunction, which then causes symptoms.
Can you tell us about this 10-year window of opportunity within which we should be thinking about starting HRT if that's a path we choose?
There is evidence that taking HRT within 10 years of your last menstrual period, that is the time where HRT can confer the most benefit in terms of protecting you later on in life. That's not to say that if you are more than 10 years since your last period and are still suffering from menopausal symptoms that you can't have HRT, but the evidence is that the sooner you take it after your last menstrual period, then that would give you the most protection later on in life for your heart and certainly for your bones.
Let's zoom in on cognitive function, the amazing role that our hormones play in brain health and keeping us, sharp and fired up and confident and, in a good mood. I read that actually estrogen pushes our neurons to burn glucose for energy. And I know that with the work that Dr. Lisa Mosconi is sharing right now and showing brain scans of basically before and after menopause and how our brain energy actually declines during that period of time. I think it's really, really fascinating to learn that we have estrogen and testosterone receptors in all the different parts of our brain that govern learning and memory, temperature and appetite control, emotion, movement, and motivations. I mean, that's insane. It's really amazing. Decision-making and personality. And when you think about the sort of average window of time when perimenopause starts, which is in our 30s and 40s, that's such a potent period of life where women are starting and growing families. They are at their prime in their career. That we've got 20, 30 years of, or 15, 20, 25, 30 years of experience, and we're in leadership roles. Things are just getting good. People are starting businesses, writing books, launching ideas and products and services. And, this is such a fun time of life. This is not a good time of life for our brain to stop working or to wake up with brain fog, feeling like our brain is just not switched on, losing the ability to recall words. And then here are some of the other kind of psychological symptoms: anxiety, irritability, panic attacks, feeling low, mood swings, feeling frustrated, tearful, loss of self-esteem, loss of confidence. I mean, this is not the kind of feeling we need that is beneficial, for our work if we're ambitious women. So tell us a little bit about how hormone replacement therapy can help us with these psychological symptoms and basically give us our brain function back.
I think it's been one of the most exciting things in the last, few years, the work that people have been doing about cognition and the importance of having your hormones replaced. There's absolutely no doubt about it. And any health professional will tell you who has an interest in women's health and menopause, many women will report memory disturbance, loss of concentration, word finding, those sorts of things, but also those other psychological symptoms of anxiety, low mood, irritability, which I think in the past no one really attributed to menopause. It was, I think, in the 50s and 60s, even though people say that their grandparents or their mothers will breeze through menopause, actually we had a really big problem in the UK with a lot of middle-aged women being prescribed benzodiazepines, so Valium, for instance. And I honestly believe that people were given Valium because they were presenting to health professionals with psychological symptoms of menopause and were given these other drugs to help, which they did, but the benzodiazepines are a notoriously very tricky medicine because you develop addiction and tolerance problems to them. But they were given those drugs because of these psychological symptoms which were not recognized as being due to menopause.
That's unbelievable. And I also read that it was considered hysteria. Mm-hmm. And that electric shock therapy was used as a treatment right up until the 90s.
Women just haven't really been served very well in that respect. And HRT is a strange, it is a medicine. And we don't seem to have the same problem with other medicines that people have. Most medicines do have possible risks associated with them. They have side effects. But I don't see the same debate going on that with certain other medicines than I see with HRT. It's become a really polarized debate, I think, with some people saying women shouldn't have it, and then obviously on the other side women say that they should definitely take it. I think we've lost actually an individual's response to what they need and what they want, and I think that's massively important when talking about HRT and offering women the ability to make those decisions for themselves, because that's really what we should be doing rather than dictating what women should and shouldn't be doing.
If somebody wants to learn more about HRT and take the next steps,
I think there are a lot of good websites that people can link up to. The Balance Menopause website is really good. The British Menopause Society have a good website as well, which is patient friendly. It might be of use actually for people. You can Google the green, it's called the Green Climacteric Scale. And that is it's basically a symptom checker for menopause. It can be helpful to women, I think, just to have a look at that and just, tick off what they might be experiencing, because it kind of validates how they feel. And that would be a step. If they are thinking they could be perimenopausal, it would help them decide whether, yes, this could be or couldn't be. And then I think it's really important to try and get an appointment with your GP, which I know is difficult at the moment, but try and get in, try and find out actually initially from the reception staff who might have a special interest in women's health within the practice, because that you don't really want to go to somebody perhaps who doesn't have that interest. And if they're and try and get booked in with somebody who perhaps has just a little bit more knowledge than your average general practitioner. And hopefully, and I think increasingly, people will be sympathetic towards your presenting symptoms of menopause and will be willing to listen to you and willing also to give you the evidence and the pros and cons of HRT, because obviously it might not suit everybody, and there are some difficult situations where HRT is difficult for some people to take. But a whole discussion on lifestyle changes and things that you can do to try and mitigate some of the severities of menopausal symptoms is also, should be part of the discussion with a health professional.
So I have friends in the UK, but also in Hungary and Mexico, who've been told things like, you're too young for perimenopause, you don't need testosterone, and all sorts of things that seem like medical gaslighting. And I've encouraged them to seek a different opinion and keep going, keep looking. What would be the next steps if your favorite doctor, or if the doctor in your practice has kind of said these things that make you feel like, second guessing yourself, like you've gone in with the wrong information? What do you do next?
I think it's really, really important for women just to really empower themselves. And there is so much good information on the internet these days. And probably, if they can afford it, to go to a private clinic if they are really, really struggling to find any help within the NHS. As I say, I think things are changing, and I think women, you shouldn't just stop at the first hurdle. I think you do need to push a little bit and to say, look, I have read a lot about menopause. I know this could be perimenopause, and I really do need some help from you. There are menopause clinics on the NHS. I appreciate there are long waiting lists at the moment for that, but increasingly there are some women's hubs that are being set up because there is such a demand on gynecology services. And I think those women's hubs are going to be really helpful for women who can't afford to go privately to get some help on the NHS.
Yeah, and you mentioned before a little bit about diet and lifestyle. So I think you and I are sort of both in agreement that HRT is one option, and it's part of a sort of like broader change in diet and lifestyle that is just very, very healthy and very supportive of our body and brain. So diet is it feels very obvious to me that diet is, lots of whole foods, real food, fruit and vegetables, nuts and seeds and legumes and animal proteins or tofu protein. We kind of that's sort of saturated across social media, and it's very, very obvious that real whole food is very, very good for us. I wonder if we could talk a little bit about alcohol, because I know that alcohol is actually something that women can tend to cling to and drink maybe a little bit more when they start to feel worse. And I just want to understand, like, why does this not solve the problem, and why does it actually make our symptoms worse?
Absolutely, undoubtedly, a lot of women who present with menopausal symptoms, they'll have been self-medicating for a long period of time, often with alcohol. And we do, it's not just menopause that people self-medicate with alcohol for, but it is increasingly common with middle-aged women who might be perimenopausal or menopausal. And the reason that, apart from anything else, it's not a great idea, obviously, to overindulge with alcohol for a number of reasons. But actually, for menopausal women, there is a tendency for that to make things worse rather than, making you feel better. There is an impact when we lose our hormones. Alcohol tends to have a bigger effect on us. So it makes you feel drunk more quickly. It can make you feel absolutely shocking the next day when you've had alcohol the night before. So even although it's a bad idea to self-medicate with alcohol to try and make you feel better, actually it's very detrimental to you, much more detrimental than maybe at another stage of your life, to drink alcohol excessively during the perimenopause and menopause, because it makes you feel worse.
And what about the role of exercise?
I mean, exercise is there is so much evidence, isn't there, these days on, exercise being preventative for a number of diseases and illnesses, cancers, heart disease, strokes, depression. And it can really, really benefit menopausal women because, as we know, and we've talked about before, cells in all our body which contain that need estrogen and testosterone, and exercise can really, really help all bits of the body. And it can also help make sure that those hormones that we do have are working to their maximum potential. So yes, so much evidence that exercise on a regular basis is really, really helpful for everybody, but particularly for menopausal women, to try and release those endorphins and all the things that we know exercise can do to help all manner of symptoms.
But we also have to be wary of that. I think I read that there are over 44 HRT products in the UK alone, different brands, there's different types, methods, doses, and it can take a while to find the right type, dose, method, the right combination for you. So I also know that once you start and it doesn't work for you, you can actually stop. So tell us a little bit about that. If it doesn't work for someone at the outset, what happens after that when they're working with a menopause specialist?
Well, I mean, first of all, what I would say is that we health professionals, we should be careful at promising women that this treatment is suddenly going to be, transformative and this will work 100%. And we need to be very careful not to create unrealistic expectation. And a lot of women, unfortunately, do come into the practice sometimes with that expectation that overnight it's going to make them, feel completely different. So we need to be a bit more measured about it. You're absolutely right. Many women do suffer from side effects of various combinations of HRT. We can, the most common problem really is bleeding problems, and that can be a real pain in the neck. And what I do when I see somebody that is going to embark on some HRT, I very much try and prepare them for things that could happen, so that when it does happen, they're not kind of scared or frightened and don't stop the treatment suddenly. I will always tell somebody HRT generally needs tweaking. It does. There's no, it's very, very rare, I would say, that I start a woman on HRT and then 3 months later, when we do a review, it's a-okay and we never have to change anything again. There is a lot of tweaking to be done to find the right preparation, to find the right regime for the majority of women. So I think it's about preparing women, not making expectation too great, and just saying, yes, we're going to be able to help you here, but it might take a bit of time to get there.
And of course, we can stop HRT as well for many reasons, including our own personal choice. Is there a special strategy for coming off HRT?
I mean, most people would recommend just maybe coming down quite slowly off HRT, so you're not going to get hit with a suddenly no estrogen, after you've been having it for quite some time. So yeah, I normally tell people to tail off quite slowly if they're gonna stop. And like you say, it is about you making the choice for yourself and how you feel. Some women don't like HRT, and that's, as long as they're understanding what the pros and cons are of it, and with the protective stuff about HRT, but they choose to come off it, then that, of course, that's absolutely fine, and we should be supportive of that, and then maybe talk about alternative therapies which might help, if their symptoms do return.
Diet and lifestyle has sort of gone a bit polarized and extreme because of social media. We're told we should be doing this, we should be doing that, we should be eating this, we shouldn't be eating that, we should be eating this much protein, we should be getting our protein from this, these protein powders. And so health and diet lifestyle has all gone a bit crazy. And if we don't sort of pull it back to the basics, then if women aren't even thriving in their 20s and 30s, then there's probably very little chance of them entering the perimenopause years feeling halfway decent.
Just there needs to be an acknowledgement that hormones are hugely important. We know they're hugely important in other areas of the body, so we should be mindful that reproductive hormones are exactly the same. They are going to they can cause really serious problems, and again, it needs to be a lot more education and a lot more understanding of the problems that women suffer as a consequence of hormone imbalances.
I think we also have a problem with nomenclature. I think they should literally we shouldn't call them reproductive hormones because they are responsible for everything. They should actually be named superpowers.
Yeah, that would be a good term.
Yeah. Jacqueline, thank you so much.
No problem at all. Thank you for having me.